Good day. The topic to be discussed today is radiation biology and its hazard. So, radiation biology, in simpler terms, is the effect of the ionizing radiation or X-rays on the living systems, what it does to biological living organisms, how it changes the molecules, how free radicals are formed. That is the study, radiation biology. So, effects of radiation on living system can be classified into two types based on mechanism of action and dose dependency. Depending on its mechanism of action, there is direct effect and indirect effect. Direct effect, wherein the biological molecules in the body are affected by photons or radiation. Indirect effect, wherein there is radiolysis of water, that is, because our bodies are made up of more amount of water, the radiation first attacks the water molecules, thereby then causing a change in the biological molecules and free radical release. Based on dose dependency, there are two types: deterministic effect and stochastic effects. We'll get to whatever it is in detail later in the slide. This is the mechanism by which the radiation affects our body. First thing is it breaks one or both the strands of the DNA, the irradiated part of our body wherein the DNA is present. Either one or both strands of the DNA can be broken. There is cross-linking of DNA strands within the helix, as in the helix is two strands of the DNA brought together. So from one DNA to another DNA, there can be parts which have been broken and then cross-linked. Change or loss of a base. Adenine, guanine, thymine, and cytosine are the bases. So either one or many of the bases could be lost in a part of a DNA. There is disruption of the hydrogen bonds that forms between the two helices of the DNA strand. So based on the mechanism of action, so I told you there is direct effect and indirect effect. The direct effect is when the radiation affects the biological molecule, where that is the RH, where R is the molecule and H is the hydrogen atom. Because our body is made up of hydrogen atoms, R is supposedly to be the biological molecule. So these absorb energy from the ionizing radiation and become free radicals with unpaired electrons. As we know, free radicals are very unstable, so they either cross-link or dissociate to form stable atoms later on. So free radicals, RH is the biological molecule, H with the hydrogen atom. With radiation, what forms is R is the biological molecule becomes a free radical along with a hydrogen atom and an electron that is released. These free radicals, there are two fates for these free radicals: dissociation or cross-linking. This free radical formed either dissociates to form Y, X plus Y, which is another free radical, or it forms another stable compound by combining with another free radical, that is S. So they differ structurally, although it forms another molecule, stable molecule, they differ structurally from the initial molecule. So there is a biological change that occurs in the stable atom as well. So 1/3 of the biological effects result in, are a result of direct effects from radiation. So the 2/3, that is the most of the part, is from the indirect radiation, that is radiolysis of water. Because our body is made up of water, that is 70% of water. Most of the photons that are irradiated, or most of the photons reaching our body, firstly hit the water molecules and then they form free radicals, then hit the biological molecules. So initially, if we look at the formula, it's a photon hitting the water molecule that forms two other hydrogen and hydroxyl ions, which are free radicals. This is exactly what happens. If you look at the formula, if there is a biological molecule, firstly the photon hits the water and it produces H and OH minus, which are released as free radicals. So when they combine with other biological molecules in our body, they form free radicals and water, and free radicals and hydrogen ions. So these are free radicals whose fate then will be determined by cross-linking or dissociation, similar to that of the direct effect. But these hydroxyl ions, when they combine with other dissolved oxygen in the body, that is oxygen dissolved in the water in the body, they form peroxides, which are even more threatening to form free radicals in our body and damage the tissue. Like I said, there are 2/3 of the radiation is from the indirect effect, and it takes about just 10 to 5 seconds for the damage to take place, but then the effects may take hours or decades to become evident. Based on dose dependency, there are stochastic and deterministic effects, and they are determined by the dose usually. So, stochastic effects, they are not dose dependent, whereas deterministic effects are dose dependent. That's how you can keep in mind, that is dose and deterministic, D and D. Stochastic effects, even a small dose, that is a dose that is diagnostically given for a patient, also can cause a stochastic effect later on in the patient's life, or can be transferred to the offspring as well. Whereas deterministic effect is dose dependent, that is higher the dose, higher will be the effect, and more severe will be the effect for this deterministic effects. The examples for deterministic effects can be osteoradionecrosis that can present, radiation induced cataract formation, induced skin burns. Okay, whereas stochastic effects, it is even in diagnostic radiology, that amount of radiation also is enough for producing stochastic effects, wherein there is sublethal DNA damage. So what can be the example for this is radiation induced cancer, heritable effects, and skin cancer, more so. So the deterministic effects on the cells, it's usually the nucleus, which contains the DNA, that's more affected than that of the cytoplasm, and the chromosomes are up for aberrations. So as we know, the cell cycle has 4 phases, that is the G1, the growth phase, the DNA synthesis phase, G2, and then mitotic phase. Depending on where the cell is on the cell cycle during irradiation, there can be chromosomal aberrations that take place. If it is before DNA synthesis for a cell, for a chromosome to be affected, or if there is radiation that is given after DNA synthesis, then there is going to be aberration in just one arm. If it is just before DNA synthesis, there is going to be aberration in both arms of the chromosome. Radiosensitivity and self type. The different cells have different sensitivity. They depend on high mitotic rate. However, if the cell is going to be undergoing further mitosis in the future also, they are going to be affected. And if the cell is going to be very primitive in differentiation, they can also be affected by radiation more so than any other cell. So these cells or these areas in the body are to be more radiosensitive than the other areas. So any region that is to be highly radiosensitive is the lymphoid organ, the bone marrow, testis, intestines, and mucous membranes, which undergo constant renewal. So they are undergoing mitosis at a very high rate. So these will be at a high rate for radiosensitivity. Intermediate are fine vasculature, growing cartilage, growing bones, salivary glands, lungs, kidney, and liver. And low radiosensitive areas are optic lenses and muscles. So the deterministic effect of the whole body irradiation, that is the immediate effect that can be seen, which is dose dependent, has an acute radiation syndrome that can present. Depending on the dose, there can be symptoms that can be seen. So initially, when the dose is about 1 to 2 gray, there are prodromal symptoms. About 2 to 4 gray, mild hematopoietic symptoms. 4 to 7 severe hematopoietic symptoms. Up to 7 to 15, there are gastrointestinal symptoms, and above 50, there are cardiovascular and CNS symptoms, and then later on death. Initially, within the first minutes or hours after exposure up to 1 to 2 gray of irradiation, an individual may experience anorexia, nausea, vomiting, diarrhea, weakness, and fatigue. Anorexia meaning thinning down due to vomiting of the food that is given after they eat. So these early symptoms constitute a prodromal period of the acute radiation syndrome. The cause is unclear, but it probably involves the autonomic nervous system. So the more the dose, more rapid the onset. That is, depending on the dose, the prodromal symptoms set in very early, and the severity of the symptoms also are greater. Latent period, after the prodromal period, there will be no symptoms at all. This is the latent period. This is also dose related. If it is for a few hours only or days, then the gray is more than 5. And if it is the latent period without any symptoms is of about few weeks, then it's about less than gray or 2 gray. Hematopoietic syndrome, initially it's about 2 to 7, but milder symptoms, and then severe hematopoietic syndrome also can result. So 2 to 7 gray, the hematopoietic system is affected. Doses in the range of 2 to 7 gray only will cause this. There is a rapid fall in the circulating granulocytes, platelets, and erythrocytes. That is WBC, RBC, and platelets. They all fall down. The clinical signs of these include hemorrhage, anemia, infection, because the WBCs also come down. So death can result from hematopoietic syndrome usually about 10 to 30 days after radiation. The gastrointestinal syndrome, wherein there is 7 to 15 gray of radiation that is received by a patient, causes extensive damage to GI tract because of the mucosal surfaces being denuded and loss of plasma. As the mucosal surface is very sensitive, there is going to be loss of it, and the ulceration of the mucosal lining can also occur. Hemorrhaging can occur. Diarrhea, dehydration, and loss of weight and septicemia can result because of the hemorrhaging and the ulceration. These combined effects, they along with the hematopoietic syndrome that resulted, can cause death within 2 weeks if fluid and electrolyte loss is not replenished, if the infection is persistent, if septicemia presents too early. Because of nutritional impairment, death can occur. Cardiovascular and central nervous system syndrome occurs when you give over 50 gray, usually for any tumor, for a salivary gland tumor, for example, in the head and neck area. The gray, yes, is 50, but then because you can't give it in a single dose, it is fractionated and given. But if it's a single dose that is given as 50 gray, death can occur in 1 to 2 days. Collapse of the circulatory system, fall in blood pressure leading to death. Autopsy have revealed in patients who have been irradiated over 50 gray that there is necrosis of cardiac muscle. They show incoordination, disorientation, convulsions. So there is extensive damage to the central nervous system resulting from the irradiation induced damage to the neurons, and fine vasculature of the brain can also occur. So how do you manage this is, initially when you know that the patient is going to be irradiated, or if it is unknown, if it can be a disaster such as Hiroshima and Nagasaki, and patient not knowing how much of radiation is going to be received by the patient. So initial symptoms can be managed, that is hematopoietic, if the patient is having prodromal symptoms, latent period and the hematopoietic phase sets in. The infection can be controlled initially. So the granulocytes cells count falls, fluid electrolyte can be replaced, whole blood transfusions to treat the anemia and the platelets, and to arrest the thrombocytopenia. Bone marrow grafts are indicated between identical twins because there is no risk for graft versus host disease. If you know that there is one person affected, then you can take the bone marrow of another person who is a matched and then give it to them to reduce the effect.